In the meantime, you look at the juxtaposition about how we're doing so well with rolling out the vaccine and how other countries are really struggling, specifically India. There have been lots of questions raised about what we can and what we should be doing. There have been questions raised about what to do with the intellectual property of these vaccines. If we can't hand the vaccines themselves over, how do we help some of these other countries? What's the answer?
Well, look, I think we should be handing the vaccines over. By the end of July, we'll probably have 300 million extra vaccines in this country between all the manufacturers. I think we could be providing more vaccines to other countries, including India. Remember, India was going to be distributing their own vaccine. They were going to be manufacturing their own vaccine. They had set as a goal about 4 billion doses out of the Serum Institute over the next year. They were going to be manufacturing the AstraZeneca vaccine. It's been more challenging to get the yields of that vaccine. They've only been able to distribute a little bit more than 100 million doses. So manufacturing these isn't trivial. I think before we start contemplating giving away intellectual property, and the only country really that's going to be able to step in and start trying to manufacture these is really China if we do give away that IP. Before we contemplate that, I think we ought to start giving away some of the doses that we're manufacturing and stockpiling here in the U.S. And the final point is it's just not a trivial affair standing up manufacturing these vaccines. And India has sort of demonstrated that with the challenges they've had scaling up manufacturing of the AstraZeneca vaccine. Even if companies are cooperating, doing a full tech transfer, so you have a partner that you're working with to do this, it could take at least a year to stand this up. These are complex vaccines that we use. It's not simple manufacturing technology. It's new age manufacturing technology.
Hey, Scott, I just wanted to go back to the IP issue for a second. And look, I very much believe in protecting intellectual property. However, as you know, there are members of the World Health Organization that say the argument here is both self-interested and bogus when it comes to the manufacturing issue, which is to say, look how long it took the U.S. to get its manufacturing up and running. Couldn't we get that? Now that even lessons, by the way, have been learned here in the U.S., why would it be so hard to actually do that elsewhere? Now, that's not to say it wouldn't be difficult, but the question is whether there would actually be a benefit and whether the argument that the companies are making, as I said, are effectively self-interested on what is now a global health pandemic.
Well, look, we just need to be honest about what we're promising. If we promise that we're going to give away the IP, we're not promising that anybody's going to get a dose from a manufacturing facility outside the United States for at least a year. And that's an optimal circumstance. I think it could take longer than that. I think the Chinese and the Russian do have the capacity to copy these vaccines. There's one vaccine manufacturer in South Africa that we could potentially work with to do a tech transfer and stand up manufacturing in that facility. They couldn't make a vaccine soup to nuts because this is a multi-part process. Different facilities are needed for different parts of this process. Even Pfizer manufactures a vaccine over multiple facilities. They could take on perhaps the fill finishing or some parts of the steps involved in manufacturing the vaccine. It would take time. It would take at least 6 months to a year. You'd have to put personnel and new equipment in there to do that. I'm not saying it's impossible, but it's not going to be something that solves the problem in the next 6 months, or maybe the next 12 months. In India, there are some manufacturers like the Serum Institute that do have some capacity to do this. They don't have the capacity to make the mRNA vaccine. So, again, you'd need to do a tech transfer and teach them how to do it. I'm not saying they can't do it, but it would take time again. And you see the problems they've run into manufacturing a relatively simpler vaccine, a viral vector vaccine. So these things are complex. We just need to be honest that if we're promising people that they're going to get a vaccine by giving away the IP, they're not going to get a vaccine from that for at least probably a year, maybe more. Maybe from the Chinese or the Russians, perhaps.
Shepard Smith here. Thanks for watching CNBC on YouTube.